experience and expertise to know that this looked serious. Early on, we worked out that beating this new health threat, a new coronavirus potentially capable of spreading quickly around the globe, would require three things: science to both understand the pathogen and find solutions to beating it, and solidarity to share and deliver those tools wisely and equitably. Science, solutions, solidarity. And there were major successes. This includes the rapid development of a comprehensive package of technical guidance on how to ready countries to detect, treat, communicate, and prevent the spread within 2 weeks of the first report of the cluster of pneumonia of unknown cause. The sharing of the genome, which triggered the development of diagnostics within the first 3 weeks of 2020, a multi-organizational supply chain system was quickly set up, which included solidarity flights that collectively delivered personal protective equipment for health workers and medical and oxygen supplies for patients. WHO quickly convened scientists and researchers in January 2020 and regularly, therefore, to develop a research roadmap for COVID-19 that accelerated the science around the virus and the creation of new health tools. These included global solidarity trials on new vaccines and treatments to speed up research and development processes. And WHO and partners created the COVID-19 Tools Act Accelerator in April 2020 to accelerate access to tests, treatments, and vaccines. We deployed emergency response teams to support governments in their times of greatest need. Working with clinicians and practitioners around the world, WHO developed a comprehensive living guidance for the clinical management of COVID-19. A common corticosteroid was found to be effective in cutting the risk of death in those with severe disease in September 2020. The development of new vaccines proved so effective at cutting serious disease and death, they represent a scientific masterclass. The increased level of coordination between WHO and member states is exemplified by more than 3,500 national regulatory authorizations in 144 member states following the approval of vaccines through the WHO Emergency Use Listing, EUL. However, while science delivered, politics too often triumphed over solidarity. While there were 1.8 million recorded deaths in 2020, there were 3.5 million in 2021, and we know the actual number is much higher. This is not to mention to the millions of people dealing with the long-term consequences from the virus. Populism, narrow nationalism, and hoarding of health tools, including masks, therapeutics, diagnostics, and vaccines, by a small number of countries undermined equity and created the ideal conditions for the emergence of new variants. Misinformation and disinformation, often spread by a small number of people, have been a constant distraction, undermining science and trust in life-saving health tools. In the huge waves of cases currently seen in Europe and in many countries around the world, misinformation, which has driven vaccine hesitancy, is now translating to the unvaccinated disproportionately dying. It's vitally important that the established scientific advisory group for the origins of novel pathogens can develop a pathway for the scientific research, search of pathogens, including for the origins of SARS-CoV-2, and we hope to see progress quickly in the new year. But I still remain optimistic that this can be the year we can not only end the acute stage of the pandemic, but we also chart a path to stronger health security. Building on the successes and failures, we must not only share vaccines faster and more equitably with COVAX and AVAT, we must support countries in manufacturing and rolling them out to everyone. And access to new treatments must also follow. This virus will continue to evolve and threaten our health system if we don't improve the collective response. Right now, Delta and Omicron are twin threats that are driving up cases to record numbers, which again is leading to spikes in hospitalizations and deaths. I'm highly concerned that Omicron, being more transmissible, circulating at the same time as Delta, is leading to a tsunami of cases. This is and will continue to put immense pressure on exhausted health workers and health systems on the brink of collapse, and again distributing lives and livelihoods. The pressure on health systems is not only because of new COVID-19 patients requiring hospitalization, but also a large number of health workers are getting sick themselves. The unvaccinated are many times more at risk of dying from either variant. Omicron is moving so quickly. In addition to vaccination, public health social measures are also needed to stem the wave of infection, protect health workers and systems, open up societies, and keep children in school. I welcome innovative solutions to reaching vulnerable communities that have not received vaccination yet, because the primary doses are the most important for people to develop immunity. Bottom-up micro-planning with strong community engagement and mobile vaccination teams, which have been highly effective in ridding most of the world of polio, are another way to get vaccines to the hard-to-reach. WHO will support countries as they look to improve access to COVID-19 tools and catch up with routine immunization. Mental health must also be treated as a core element of our response to and recovery from the COVID-19 pandemic. At the G7 and G20 this year, I challenged leaders to ensure that by the end of this year, countries have vaccinated 40% of their populations and 70% by the middle of 2022. 92 member states out of 194 missed the 40% target. This is due to a combination of limited supply going to low-income countries for most of the year, and then subsequent vaccines arriving close to expiry and without key parts like the syringes. And in the case of about 20 countries, supply chain and distribution issues are also impacting rollouts. 40% was doable. It's not only a moral shame, it costs lives and provided the virus with opportunities to circulate unchecked and mutate. In the year ahead, I call for leaders of government and industry to walk the talk on vaccine equity, both by ensuring consistent supply and helping to get vaccinations actually into people. Vaccine supply, for now at least, is improving, although the emphasis on boosters in rich countries could cause low-income countries to go short again. I call on leaders of rich countries and manufacturers to learn the lessons of Alpha, Beta, Gamma, Delta, and now Omicron, and work together to reach the 70% vaccination coverage. This is the time to rise above short-term nationalism and protect populations and economies against future variants by ending global vaccine inequity. I want governments, industry, and civil society to work with us on a campaign that targets 70% vaccine coverage in every country by the start of July. I also want to ensure COVID-19 care pathways with new treatments are available in every single country, and to ensure people get on treatment at the optimum time. We need to get tests everywhere. Ending health inequity remains the key to ending the pandemic. As this pandemic drags on, it's possible that new variants could evade our countermeasures and become fully resistant to current vaccines or past infection necessitating vaccine adaptations. The technical advisory groups for virus evolution and on COVID-19 vaccine composition continue to review evidence of the variants and analyze the performance of COVID-19 vaccines against them. Any new vaccine update would potentially mean a new supply shortage. So it's important that we focus on building up local manufacturing supply to help end this pandemic and prepare for future ones. One way to increase production of life-saving tools is to pool technology. WHO's mRNA technology transfer hubs are moving ahead in developing an mRNA vaccine. Recently, the COVID-19 Technology Access Pool and the Medicines Patent Pool finalized their first licensing agreement with the Spanish National Research Council for a serological antibody test. I hope there are many more breakthroughs like this in 2022, including for vaccines and treatments. Sharing technology and know-how, as well as waiving the intellectual property rights around COVID-19 tools, should have happened early on in the pandemic. But it's never too late to come together to do the right thing. In 2022, WHO will work with our member states to build well-financed health systems, strengthen preparedness, and ensure the equitable distribution of health tools. From the new WHO BioHub system, which offers a reliable, safe, and transparent mechanism for WHO's 194 member states to voluntarily share novel biological materials, to the new WHO Hub for Pandemic and Epidemic Intelligence based in Berlin, WHO will build mechanisms to enhance partnership. In this vein, the development of a new binding accord between nations on pandemic prevention, preparedness, and response will be a key pillar. I hope to see negotiations move swiftly and leaders to act with ambition. This is the moment for leaders to banish the politics of populism and self-interest, which are derailing the COVID-19 response and threaten to undermine the response to the inevitable next disease X. While 2021 has been hard, I ask everyone to make a New Year's resolution to get behind the campaign to vaccinate 70% by the middle of 2022. We have 185 days to the finish line of achieving 70% by the start of July 2022. And the clock starts now. If we drive this campaign together, we will all be in a much better place by this time next year. Happy New Year. And Tariq, back to you.
Thank you, Dr. Tedros, for opening remarks from journalists who are on Zoom with us. Just to remind everyone that we don't have a simultaneous interpretation today, so we may try with our language skills here to help, but normally we would do the questions and answers in English. Today, please click on a raise hand icon so we can get you in line, and if possible, only one question per journalist. So let's start with Bianca Rotier from Brazilian Global TV. Bianca, if you can hear us, please unmute yourself and go ahead.
Thanks a lot, Tarek. Good morning, good afternoon, everyone. Yeah, first of all, I hope you had a great Christmas, and I wish you 2022 full of health. I would like to ask Dr. Tedros to share an overview of these 2 years in relation to Brazil. We saw many controversial messages, and recently President Bolsonaro criticizing vaccination to children, but the country ends the year with a good vaccination rate. And I also see that Brazilians now are more relaxed, and unfortunately covering the WHO and Europe, I saw that everything we experienced here ended up being repeated in Brazil weeks later. So which message, Dr. Tedros, would you like to send to Brazilians? And just a clarification, Dr. Tedros, you said you expect to see the end of this acute stage of the pandemic next year. So in other words, does it mean that the pandemic won't end in 2022? Thanks a lot.
Thank you very much, Bianca. I understand that you have been close to our building today, so welcome. Let me see if Dr. Ryan is online, as he was quite often answering questions in particular countries. Dr. Ryan.
Hi, can you hear me?
Very well, Mike.
Okay, great. And thanks for the question. I think you noted yourself in the question that things had been improving in Brazil over many months. There's been a persistent downward trend in both cases and deaths, and that's to the credit of the Brazilian people and the measures that have been taken, and also the uptake of vaccines. Brazil experienced 2 very large waves, well, multiple waves of infection over a prolonged period of time. In fact, was a heavily affected country for a very long period. Not only did Brazilians experience that, but many people around the world saw the images of overwhelmed hospitals in Latin America, and in particular in Brazil. But all countries have faced those moments. Almost all countries have faced those moments in this pandemic. And it really is by bringing together the work of the health authorities at the state level and at the federal level, and engaging with communities and getting the word out there about the effectiveness of vaccines, I think has helped stabilize the situation. But you are also right that in many ways the experience in Europe and potentially the experience in North America now, we know the Omicron variant is in South America, is in Brazil. So the likelihood is that there will be continued waves of transmission all over the world, and South America and Brazil are no exceptions to that. So as Dr. Tedros has said time and time again over the last number of weeks, this is time to prepare. It's time to get health systems ready. Even if the virus turns out to be in an individual basis slightly less severe than previous variants, the sheer numbers of cases, as we saw previously in Brazil, can put huge pressure on the health system. So getting the health system ready, we saw the shortages of oxygen, the shortages of beds, all of that can be managed and dealt with now if it's prepared for. And it's better to be prepared. If the wave does not come, then that's okay. That's good news. But Brazil and other countries need to be prepared for a rise in cases. They need to be prepared, as we've seen in Europe, for a rise in hospitalizations, and be ready to face what what will come. A focus on getting the most vulnerable vaccinated, making sure all health workers are vaccinated, older persons, people with underlying conditions are vaccinated. That is key. There are still pockets in every country of unvaccinated or under-vaccinated people. And it's really important that people are sought out and people are offered the vaccine again and again in their own environments, if possible, and in a trusting and situation. So with regards to the pandemic, we've been saying this for a very long time, the acute phase of the pandemic that's been associated with the tragedy of deaths and hospitalizations, that can end in 2022. The virus itself is very unlikely to go away completely and will probably settle down into a pattern of transmission, low level, causing occasional outbreaks in under-vaccinated populations. And we hope that that is the end game here. But we're certainly not there yet. This is going to be a bumpy road on the way to low levels of COVID. But we do hope, as the Director General, Dr. Tedros, has said in his speech, that by getting the vaccine equity equation right, by continuing to implement the measures we have at our disposal, by continuing to protect the most vulnerable in our countries and in the world, we can bring the acute phase of the pandemic, the phase of death and hospitalization, to an end.
Thank you, Dr. Ryan, for this. We will move to the next question, and that will be Antonio Prato from FA News Agency. Antonio, please unmute yourself. We don't seem to hear you, Antonio. Let's move to the next one. Antonio, we will try to come back to you. Let's try with Anne Galland from Telegraph. Anne, can you hear us?
Hi, yes, can you hear me?
Very well.
Great, thank you, thanks so much. Dr. Ryan and Dr. Tedros, you both talked about ending the acute phase of the pandemic. So is that contingent on the 70% vaccine? Do you think the acute phase of the pandemic won't end until 70% of the population are vaccinated? Is that what you see? And how likely do you think it is that we will move away from this acute phase of the pandemic this year and move into the next stage? Thank you.
Thank you, Anne. I can see we have lots of questions on a general outlook. So, Mike, please.
Well, maybe Dr. Tedros would like to comment, but I can begin. Certainly, yes, we would all like to see the acute phase of the pandemic come to an end. And that is the history of pandemics in humans. The pandemic viruses like flu viruses, the pandemic ends, but the virus stays around. In fact, the virus that caused the pandemic in 2009 of H1N1 is still around, but it's not causing the kind of death and destruction that it did at the time mainly because we've been vaccinating the most vulnerable people. And if you look at the strategies we use in influenza, we don't try to vaccinate everybody against influenza, although it could be a very good idea. But what we focus on with the limited amount of vaccine available is to focus on vaccinating health workers, vaccinating older persons, vulnerable younger people. We vaccinate against the negative impacts of getting the infection, which are severe disease, hospitalization, and death. In that sense, heading to try and vaccinate everybody in the population who could potentially have a severe infection is the primary objective. And that was the objective set with the original idea of having 20% and 40% of the population covered. As Dr. Tedros has said, 92 countries, I think, Dr. Tedros, missed that deadline. And there's very, very much still in a very vulnerable situation with large numbers of people within their countries still vulnerable to severe infection. But not only that, even in high coverage countries, even in countries in the industrialized north that have overall high vaccine coverage, within those numbers lie very, very strong differences in vaccine coverage, depending on your socioeconomic class, depending on your ethnicity, depending on which part of the country you live in, urban versus rural. So there are real differences in vaccine coverage in people within countries as well. So this isn't just about equity between countries, it's equity within countries needs to be addressed as well. The 70% number is really about trying to get to the point where you have effectively your full adult population vaccinated and all your vulnerable individuals vaccinated. That's the situation we would really want to be in. If we're going to both impact the severity of the disease or the impact of the health system, but also have a significant impact on transmission, then the higher the vaccination levels, the more we will have impact on that. There is a challenge. The vaccines don't perfectly prevent transmission, but they do prevent transmission at some level. And you will have to have very high vaccine coverage in order to have an impact on transmission. But if you can get to those higher vaccine coverage levels, you will have an impact on transmission, especially with natural infection as well. So I think there is a strong prospect of getting there. We have to get there. It's not just an issue of equity. It's a real question of getting out of the place we're in. And getting out of where we are requires us to get much higher levels of vaccination. You can call it 70% or 65 or 75, that's a number. But getting to a point where the population at risk of having any form of severe infection or long COVID, getting that out of the equation is the primary objective here, and ensuring that we can also suppress the emergence of new variants through reductions in transmission.
Thank you. I think Mike had already said the key issues. Maybe a few things to stress. On the 70%, we hope that it could end it could help in ending the acute phase of the pandemic. However, the key element here is we have to cover the most vulnerable parts of the population. These are the elderly and people with comorbidity, and also health workers. As you know, many countries who have already high coverage, 70%, more than 60% of coverage, are seeing a substantial number of hospitalization and deaths. And this is happening in the unvaccinated population. And that's why also in my speech, I said we need to have a campaign like the polio campaign, which is house to house, identifying the at-risk group and vaccinating those. You know, the average 60–70% wouldn't mean anything if the most vulnerable is not vaccinated. So when we say 70% in each and every country, if all the at-risk groups, the older, the senior citizens, people with comorbidity, and health workers and others are included in that 70%, then we can see minimized hospitalization and deaths to the minimum, and that could lead us into the end of the acute phase of the pandemic. So as we even speak, those countries who have high vaccination coverage, I think they should, in order to reduce hospitalization and deaths, they have to focus at the risk group who are not vaccinated. And that's why the last 2 weeks, we said repeatedly, the most important the focus should be on vaccinating the unvaccinated, or protect the unprotected. That would have a better impact and also help us in making progress towards ending the acute phase of the pandemic. Maybe one thing with Brazil, by the way, with vaccination, I think as far as I know, if I remember, the coverage is already more than 65% fully vaccinated. And the overall situation also looks really much better in Brazil. And to what Mike said, what I would add is, continue with vaccination, especially those vulnerable should not be left behind. But at the same time, it's implementing the comprehensive measures, the public health comprehensive measures. So not vaccination alone, do it all. And I think the situation will continue to be better in Brazil too. Thank you.
Thank you, Dr. Rand. Thank you, Dr. Tedros. We will move to next question. That's Reuters. Stephanie Neberhay. Stephanie, please.
Thank you, Tarek. I wonder, a question either for Sumya, if she's on the line, or perhaps Mike, regarding the change in the Centers for Disease Control in the US, their advice regarding their shortening of the recommendation for isolation time from 10 to 5 days for asymptomatic cases. So wondering if you have concerns on that and what your data might be telling you about how long people with Omicron shed virus or potentially transmit it. Do you have concerns about that new shortened time frame, please, which other countries have started to pick up on too? Thank you.
Thank you, Stephanie. Let's see if Dr. Abdi Mahmoud would like to say something on this. Dr. Mahmoud, please.
Thank you. That's a great question. I just wanted to bring back again why we are doing quarantine. And the main objective has been to always to break the cycle of transmissions. So different countries and different parts of the world are in a different situation. Some parts of the world are seeing a low incidence and able to even push the quarantine from the WHO recommended 14 days to 21. Other countries are finding the balance. So at WHO, what we have been recommending is 14 days, and some countries can shorten that based on the testing that. So there are a lot of studies coming up, but what we have seen more and more countries applying a practical health aspect of what needs to be done, balancing the workforce required and the society and the overall objective, what they need to achieve from containing the virus or making this balance. So I think the US CDC may have more information, but what we have gathered right now is too early to determine in terms of the incubation and the infectious period, but more related to balancing the society, whether you go in the full lockdown or the lesser of the two evil. Coming back again in terms of what we recommend to H1, we have been recommending again, comprehensive risk-based approach and protecting the vulnerable. While the overall part of the health workforce can be relaxed, we need to take care of the long-term care facility, people who are immunocompromised, where one infection can be debilitating and life-risking. So I think that in summary is a risk-based approach, and different countries are in a different situation.
Thank you, Dr. Mahmoud, for this clear explanation. Let's move on, and we have someone we have not heard from before, Sloan Smith, Eyewitness News from Bahamas. Sloan, please go ahead.
Hi, hello, good morning. Can you guys hear me?
Yes, very well. Please ask your question.
Good morning from the Bahamas. My question is, with the global spread of the new Omicron variant, there's been new burgeoning concern that the antigen tests that are currently being used to identify COVID may not be as effective in identifying the Omicron variant. My question is whether who recommends countries to continue using the antigen testing for screening, or should countries move towards solely the PCR testing to ensure accuracy in identifying infections and contact tracing? And with that, Caribbean countries and smaller countries like the Bahamas who use testing for people coming into the country. Thank you.
Thank you, Sloan, and welcome to WHO Press Briefings. Maybe Dr. Mahmoud, would you like to have this one?
Thank you. In terms of the RDT approved by WHO under the EUL, we haven't had any studies confirming that. We're aware that FDA has released press that some of the currently in some of the US are not payable. But as of now, our lab colleagues have been very closely working through the TAG-VE, and that under the WHO EUL, the current RDT are able to detect and function that. So it's a multi-layer that the RDT are working, and then another layer of the PCR. So we work closely. If we get more information of the overall, some of countries are using different ones that are not approved by the local approval authorities. But for WHO, the main ones are still functional and able to detect Omicron.
Thank you, Dr. Mahmoud. We will now move on. We have Simon McCarthy from South China Morning Post. Simon, would you please come in?
Thank you for taking my question and for holding these briefings without fail over the past 2 years. Happy New Year. So my question is about the effectiveness of vaccines against the Omicron variant. I know that we've started to see a few initial real-world studies, and I'm just wondering first how important it is to see the real-world data versus just neutralizing antibody studies. And then if you could explain a little bit more about how the WHO may be coordinating or working with local teams who are in a position to do these real-world effectiveness studies, and specifically whether there are efforts to ensure that the data generated for all those that there is data generated for all those vaccines which have received WHO EUL. Thank you.
Happy New Year to you, Simone, as well. Dr. Swaminathan, are you on with us? Could you please answer this question?
Yes. Thank you, Tariq. Can you hear me?
Very well.
And thank you very much for that question. I think it's a very insightful question because you did ask about, first of all, studying vaccine effectiveness and distinguishing between laboratory-based assays of neutralization of the antibodies and how the antibodies are neutralizing the virus in the laboratory and the real-world data, where we're actually looking at whether people are getting sick and what proportion are getting sick and needing to be hospitalized or dying compared to what happened with the other variants. And so as we've explained in these pressers before, there are multiple factors that account for vaccine effectiveness. One is the vaccine itself. I think we know that vaccine effectiveness varies a little bit between vaccines, though the majority or all of the WHO EUL vaccines actually have very high rates of protection.
And we're going to come out of that WHO briefing that was led, of course, by Dr. Tedros Ghebreyesus, taking us on a journey really on what has been happening. But his key message is that the world has to come together to make sure that people are vaccinated 70% by July next year. That's the aim. And this can only happen if all the world's leaders, particularly the richer nations, work together to make sure that we work towards that goal.